So let me turn it over to you, Joe. The first question I have for you is, how is this tool different from all of other tools? A lot of journalists now are using CrowdTangle, a Facebook tool, and I'd like you to talk about that in BotSlayer, Facebook Political Ad Collector, Hamilton 2.0, Hoaxy, Iffy Quotient, Twitter Trails, Who Targets Me? I'm sure I haven't listed all of them. So can you just first, before you show us the tool, why is your tool different, better, more useful to journalists than what's already out there?
I think the scale of the challenge of misinformation and disinformation, the new technologies being deployed, is so massive. It really takes a constellation of different programs. And each one of those programs that you listed has pros and cons to it, or limitations, as does ours. So how I would approach it as a researcher is we're often triangulating sources. So we use our own tool, and then we'll look at a lot of the other tools you just listed. Some of those tools only use Twitter data, as opposed to other media data. Some of them are just looking at bots or automation. Ours pulls from a range of media sources. Another primary difference is that with Project Vector, with this tool, there are public health practitioners who are actually in there every day, and they're trying to curate the data and look with human eyes to make sure that what you're seeing is actually representative. So there's less perhaps automation going on than with some other tools where there's not a human checking in over the course of every day. So, pros and cons to each tool, but I would say it's the public health lens and the humans logging in every day that maybe is the biggest difference.
Okay, terrific. All right, so I think most people are now in on the call. I want to flag for you that all of you should have been emailed the tool itself. And Joe is going to share his screen and just rip through how to use it, and then we'll take questions from you on any details you might have.
I know I don't have very much time, so I'm going to be talking quickly, but there's an opportunity for questions after I get through just the quick walkthrough. Project Vector has been pulling data from multiple media sources since October 2019. So we have a few months of data now. It's funded by the New York State Health Foundation, and it tracks not every reference to vaccines in public media data, but it's specifically focused on references to vaccine opposition. My bias as an individual and the bias of PGP, my organization, is public health. That's the lens that we see this through. So I'm a public health practitioner myself. And I am concerned about the rising vaccine hesitancy and sort of mistrust in science and public health. So that's my perspective on it. And that's why we built the tool, and we provide this data to health reporters and public health organizations, because I don't think we can address legitimate concerns and illegitimate concerns unless we know what people are talking about, unless we know what those concerns are, and we understand the talking points, and we understand where it's coming from. And this is new to public health. We're still trying to adapt to this fragmented media landscape that we all exist in these days. But if you go to Project Vector and you sign up, typically we'll approve you very quickly. This is what you would be presented with when you first showed up. So there's usually a little overview video of the data that we've presented from the month prior. And this is kind of where the human curation comes in. If you can see here, what we're doing, this is updated every week, is we'll tell you typically it's 3 stories. So it's 3 pieces of information, often misinformation or disinformation, that's being spread through social networks by individuals who are, for their own reasons, opposed to vaccines. And so again, this is supposed to be a means for us all to be more aware of what the talking points are. And if there is information in there that is not factual or not grounded in the evidence, it's designed to be a way for public health to address that, to respond. So you can see here are 3 stories this last week that were very popular and circulating around on Facebook pages and Twitter accounts and other places where vaccine hesitancy and vaccine opposition often is placed and percolates, and then eventually spreads through all online media. I won't go into these, but this is just meant to be a capability discussion. What we've also done is, because this project started in New York, we do the same thing for upstate New York and then New York City. Over the next coming weeks, in fact, launching just next week, this will be a more robust tool, and we're adding in a dashboard that's specific for every single state in the United States, so that you can see, is there a difference between where I live and where what's spreading around nationally. And I can tell you that we're also planning on making an interactive dashboard for health reporters, for health journalists as well, because I realize there's a different use case for a public health practitioner and a journalist. To show you a bit more, there's a data tab here. So this will show you over the last week, here are how many individual references to vaccine opposition we tracked, where it came from, so the different types of media sources, media breakdown. And then this is kind of where the curation comes from. We go in, there is a lot of machine learning and natural language processing that's part of this. There are enormous amounts of data, but we'll go in and we'll try and help you, if you have just a few seconds, understand what are the talking points about, what are they referencing, and then are they talking about particular health conditions? And you can see here we've divided up by health conditions. And then we go themes. So talking points shift all the time. And so every week there are changes. And you can see here we've listed a lot of the conditions that are talked about in a given moment, as well as a lot of the themes. Then if we go down, you can see this is focused on Twitter. But you can see that the top tweets around vaccine hesitancy and where they came from, these are links. So you can actually click here and that will open the original tweet. And so you'll get familiar with the individuals and the organizations and the accounts that are most responsible in a given moment for spreading messages that are opposed to vaccines. And we also have the websites as well. So some of these are blogs, some of these are forums, some of these are websites, but what we're trying to do here is to help individuals and organizations that are looking at this through the lens of public health understand what is vaccine opposition. I hear about it, who's doing it, who is that, what are they saying, so that we can wrap our heads around it. Here are Twitter authors. So those of you who have covered this topic before, a lot of these individuals will not be new to you, but some are. Some do actually change week by week. And you can see these are Twitter accounts that are most often mentioning vaccine hesitancy or vaccine opposition. These are the accounts that are most influential. So not all of these are vaccine opposers or anti-vaxxers. These could just be really popular accounts that are mentioning vaccine hesitancy. So for example, CBS News is covering vaccine hesitancy in this case. And then you have accounts by engagement. So Lotus Oak 2 is probably the most famous anti-vax Twitter account. And that account gets a lot of engagement every day, every week, very heavily followed, and is a really core figure in the leadership of the anti-vax movement. And then at the bottom here, we have automation. So like other tools that Sunny listed off earlier, these are pieces of information that either because of bot activity or because of some other form of automation are amplified across Twitter in particular, but also across blogs and websites. And we highlight this because we're trying to show if these are spreading further than human thumbs can do on their own, we feel like that's important to keep track of. Now, I'm going to jump real quickly. This would be what a more interactive dashboard looks like, and this is what's coming. Signal Labs is our data provider, so not involved in this project, but that's where the data comes from. I wanted to show this because these graphs here, what you're looking at is the difference between pre-pandemic and during the pandemic. And vaccine opposition has actually skyrocketed during the pandemic because of the pandemic. So both sides have become more entrenched. There are new players in the anti-vax movement. There are new talking points. All the old players, all the old leaders are still there. They're still involved, but they're adding new ones. So you can see here, again, these are just mentions of vaccine hesitancy or vaccine opposition, really. Before the pandemic started, we had about 5,400 a day, and now we have 14,400 a day. So just an enormous spike in opposition to vaccines. Here's a different representation of the same data. You can see here just an incredibly huge spike has occurred really since the pandemic started. A further entrenchment, a further doubling down on really a belief system. Here you have what a lot of these messages are about. So you have COVID-19 is obviously a really popular topic of conversation, but vaccine ingredients are still a big deal. There's a war on Bill Gates by anti-vaxxers. He's become enemy number one. So a lot of the conversation is against Bill Gates in particular. He's become the face of vaccines. Discussion about mandatory vaccination. A lot of vitriol thrown at Dr. Fauci, still another face. And then that recent documentary that came out called Plandemic, that spiked the conversation as well. And I think you can see here, if I remove some of these topics, you can kind of get a relative sense of the increase over time. But you can see it's right there in the data. You have pre-pandemic and then during, and there's a really big change. Word clouds here. Robert F. Kennedy Jr. is an enormously influential figure in the anti-vax movement. He is one of the de facto leaders, and he uses his social media accounts to daily attack vaccines, as well as individuals who promote them. You can see here, these are the trending stories. So Robert F. Kennedy Jr. comes up often, along with Andrew Wakefield, sort of the discredited British physician who wrote the original studies trying to link MMR vaccines to autism, which was debunked, and his medical license was taken away. But he's living in the U.S. now, and he's a really popular figure, and they're very large followings, and those followings are growing. Popular tweets in the moment, but I'm going to skip. So here's again just pre-pandemic on the left here, and current situation here on the right. And I wanted to just give you some really quick data. Only about 50% of vaccine leadership carried over into the pandemic. So there's another 50% on top of that now that are new emerging leaders that have taken the crisis and are putting forward their own talking points, attacking vaccines. And if you look at those, who they are, about 30% of these new individuals are self-proclaimed doctors. And so we haven't verified whether they're actually doctors or not. They say that they're medical doctors. And a lot of their conversation is directly personally attacking Dr. Fauci. Then you have another 30% who are parents that are opposed to vaccines. So a lot of new individuals who are not part of the debate have jumped into it. And again, we don't know if they're really parents or not, but they're saying that that's their reason for concern. 10% are open conspiracy theorists. So most of what they say all day, every day are conspiracy theories. 10% are conservative activists. And then 10% are granola activists. So that's an interesting thing about this whole vaccine opposition movement is you really have individuals on both sides of the political spectrum who probably agree on nothing else in their life except for this topic. And then you have some smaller numbers. There's some elected officials who spread information, things like that. I know I'm coming up on time. I wanted to provide this to you. So much of this work is trying to look for signals. And so if you treat it like disease surveillance, there's a thing called Sentinel Surveillance. And that's where do I pay attention to the most, because it shows me a signal of what probably is true elsewhere. So these are the Facebook pages that we pay attention to the most. These are anti-vaccination Facebook pages. There's hundreds on Facebook, but these are the ones, if you're trying to just get a real quick temperature check, what's coming, this is where we look to. And then there's things like this what I probably would term questionable news site. And the reason I'm showing this is what we have found is as social media companies are getting better at playing this game of whack-a-mole, of shutting down content that isn't scientifically accurate, Anti-vaxxers are getting better at circumventing that. And the manner of circumventing is they're going to accounts that are harder for social media companies to shut down. So private Facebook groups or well-known figures who for political reasons, it'd be very difficult to close their accounts, like Robert F. Kennedy Jr. So there's been this consolidation of around these different media channels in response to Twitter shutting down Twitter accounts, Facebook shutting down Facebook accounts. They're going to safe places, these islands, and they all. What's interesting about this movement is they're very coordinated. So when this occurs, there's a call to go here. They all actually do go there, and that's where they start getting their information. So that we wanted to share that with you because it is a changing landscape. And I'll end here. Right now, there's a Health Freedom Summit. These are the most famous anti-vaxxers in the world, as well as some new individuals. It's a like every conference these days, it's a Zoom conference. You sign up, but there's MDs, nurses, political figures, parents, and they're all sharing true or questionably true or outright false information. But the whole thing is it's openly about anti-vaccines, and it's how to do grassroots advocacy, how to get bills passed, how to spread information, how to start a Facebook page. So this is not something that's going away. It's something that's increasing and getting much more sophisticated. And I would argue, as have many other individuals, if you're looking at this from a public health perspective, we are woefully unprepared for the opposition to vaccines. I'll stop there.
Okay. Well, I see a number of people have joined the call midstream. Welcome. I'm Sunny Efron, president of the National Press Foundation, and our guest today is Joe Smizer. So I'd like to just put this in a little bit of context because I think some of the journalists involved in these stories may be on the call today. I think most of you know that the polling around this issue has been changing and it's rather sharp. Only 49% of Americans in an AP University of Chicago poll earlier this month. It was the NORC panel at the University of Chicago along with the Associated Press. Only 49% of those who responded said that they would take a coronavirus if and when one were developed. And 20% said they absolutely would not. And only and another 31% were undecided. And then a Reuters poll, and again, if any of the journalists responsible for these stories are on the call, please feel free to raise your hand and ask some questions. The Reuters poll found about the same hard opposition. 14% said they would not take the vaccine no matter what. Another 11% said they were unsure but inclined not to take a vaccine. So Joe, before we get into detailed questions about the tool, I just want to ask, opposition to, mistrust in science has been growing, has been a phenomenon since the 1970s. It's been growing. Your data shows that it's, the amount of anti-vaccine messaging has tripled since the start of the pandemic. Clearly, public health authorities, state and local, federal, have spent millions of dollars and years trying to persuade people that vaccines are safe and effective. Here we have a vaccine that hasn't even come out yet. Clearly it's not working. So could you just say something about why are we losing? Why are the vaccine safety people losing so badly?
That's a good question. Yeah, I think there's kind of a confluence of factors, but one of them is all of your we have allowed the education about vaccines and all of the information about vaccines to come from traditional public health authorities. That's the tradition in the United States. In public health, you're not trained to have an argument. You're not trained to have an opposition. You're not ready for it. You rely on a neutral telling of the evidence, and you hope and expect that the public will listen to you and trust what you're saying and make decisions based on that. That is not the world we live in anymore. And so this tradition of a unidirectional expression of science, I think, is an antiquated one, unfortunately. And that has come, so if you're putting a CDC official or a county health director or a scientist up against hundreds of Facebook pages and tens of thousands, hundreds of thousands of individuals who have predetermined that they're not going to believe what you're saying. And you keep your tactics exactly the same. You just keep sharing your same 3 talking points that vaccines are safe and effective. You will lose because you're not playing the same game. Along with that has been, like I mentioned earlier, the fragmentation of the media landscape. So, in a public health organization, they have oftentimes one person who's gone through media training and is allowed to speak publicly about anything. Now you have one person's opinion matter as much on Facebook and on another social media account as a world-renowned expert in vaccines. They have the same weight. And so that's a huge challenge. And if you pair that with just growing discontent and frustration with science and with authority, with government, you pair all those things together, it's a perfect storm for where we are now. There's something that's called cause stacking that's going on right now, and all that means is you have the anti-vaccine group used to be driven by really concerned parents with legitimate concerns. They are still there, but now you have celebrities coming in addition. You have a very savvy use of social media. You have constantly shifting talking points. So whatever is going to stick with a particular group, they'll use it. Public health just uses the same talking point over and over and over again, no matter who you are. There's no tailoring involved. And so, yeah, I think it's going to get a lot worse before it gets a lot better. And 10 years ago, people were saying it's going to get a lot worse before it gets a lot better. So we haven't really seen this mobilization that we need to yet on the scientific side and the public health side. Reporters, I think, are doing a very good job of covering the shifts in the landscape and the anti-vaccination movement. But of course, everyone could be covering it more. But I actually would like to see scientists and public health and other people who have skin in the game, which is almost all of us, be talking about this as well and chipping in. It shouldn't just be on a news organization to inform people, and then we all kind of go, "Oh no, this is horrible," and we go about our days and nothing changes.
Okay, we have a number of questions coming in about the tool and also about the movement itself. Reminder, everybody, please feel free to raise your hand and also put your questions in the Q&A. Joe has kindly agreed to stay on past 12:30 to answer questions because I think that we are going to run over with so many questions coming in. Let me give you the first question about the movement as a whole. Can you say anything about where the funding for the anti-vaccination movement comes from? And do we think any of this is, foreign, Russian, Chinese, or do we think this is a purely domestic phenomenon? Obviously, we've seen vaccine hesitancy increase in Europe as well.
It is a global problem. That's certainly true. And interestingly enough, we get a lot of, here in the U.S., we get a lot of Australians who are opposed to vaccines jump into our conversations, and vice versa. There's a lot of commonality between Australia and the United States. Part of it is the traveling patterns of leaders in the anti-vax movement. They view this as a global opportunity, a global platform. They know how to use social media, and they will go and they will talk where they're invited to talk. The funding is difficult to determine. That is an area for, I think, increased reporting. There are groups, almost all these groups fundraise. So there are open calls for funding. There are some wealthy business people in the United States that are opposed to vaccines and government overreach, as they term it, and they're benefactors to certain groups. Leaders in this movement get speaking fees when they show up. Documentaries are made, and in some cases you pay to view the documentary. So it's funding-wise, it's more disparate and disconnected than public health. Sunny, like you made the point in the beginning, we spend many, many millions of dollars a year promoting vaccines. So there's actually much more funding on the side of vaccines. The problem is that there's not, I would say, a modern strategy behind that funding. And there doesn't seem to be a lot of acknowledgement, a lot of tie-in with public health funding that there is an active opposition working against you, and you need to react to that. The other side is more, there's a narrative that they're working, they're just fighting the good fight, and there are big forces against them, and that can be a really effective fundraising talking point. This conference I showed, you pay a conference fee to go to the conference, so they're just trying everything that they can to. They're a true grassroots movement. They're just like every grassroots movement. They're trying to raise money any way they can.
Okay. We do have one question about the tool itself from Michael Bradbury. Joe, can the tool be used to determine whether bots or real people are generating anti-vaccination data conversation trends? Can you distinguish?
At the bottom of it might be here. We do a little bit of that work for you. So again, not all of these are bots, but there is some automation behind them. So I can tell you how we do it internally. We triangulate a lot. So Sunny had listed some of those other misinformation tools in the beginning. We use those tools. So we get a lead from our tool, and then we'll go and we'll triple confirm that an account is a bot, for example. And so just like any good researcher, you should never just use one tool. And so our tool is one of, like I said, a constellation. There are tools that are better than ours at using some math to help you identify whether a thing has a very high likelihood of being a bot. So I would use ours this is a tool that's helpful for understanding narratives and pieces of information that have a lot of traction right now and are being shared really widely. And then you can take this and you can use a couple of the other tools and you can start building out what's really behind this, who's a more full picture of the spread of misinformation through social networks. Twitter is the easiest site to do that for, because Twitter allows 100% of its data to be available to monitoring platforms and researchers, whereas other sites and networks will give you only a portion of their data or no data at all. So most of the research you see published is on Twitter.
So we have two related questions in the chat from Anna Miller and Susan Berger. How do you recommend journalists cover the movement without fueling it, Joe? And how will this tool impact the influence of the anti-vaxxers, which I think is reflecting a concern that the more you call them out, the more oxygen you give them. How should journalists handle this problem?
I can just tell you my personal opinion, because I'm not a trained journalist, but I do think we're past the point where we can no longer tell people who's behind the movement and pull back the curtain. There's a lot of concern about that up until now. But I think just actually educating the public about who is doing this, why are they doing it, what are their tactics, would be really helpful. We do that for other movements, other social movements, but I think the mystique around the anti-vax movement is a problem, because no one really, if people are aware of it, they think it's a problem, but they couldn't point you to really who's behind it, where's it coming from. So there's been some good stories recently on tracking the spread of pandemic, for example, and some really compelling good work. And I think just more of that would actually be great. Tracing the funding, that's a big one. We still don't really understand where a lot of this funding comes from, because it's so grassroots. But this coming together and using owned platforms now in response to social media sites trying to monitor this better is going to become a much bigger issue. And so I think that's something to write about now is, are there podcasts popping up? Are they aligning themselves with, for example, conservative radio hosts or owners of conservative news sites? Is that happening? Because that's going to be much harder to do anything about. It's much easier to just, hide a tweet than it is to hide an entire news network. So I think those shifts would be an interesting thing to cover. Also, just their talking points change all the time. No matter who you are or what you care about, they have a talking point for you. So that would be also interesting to dig into, and that would be apparent in a tool like this. You could see week over week how it changes.
Okay, so a related question to what you just said about the subgroups and the segmentation of various interests and concerns about vaccines. We have a question from Shannon Firth. Do you see any subgroups that are anti-vaccine in general, but pro-COVID vaccine? Or is it?
Oh, interesting. No, we don't. That doesn't mean that they're not out there. But I haven't seen that. I saw some anecdotal, coverage, stories of there were people shifting their opinions. But I, at least in our data, I don't see that. That seems to be more anecdotal than reflective of the whole situation. Doesn't mean they're not out there, though. I just haven't seen it.
Okay. Another question from Daniel Allen, Business Insider. The anti-vaxxers say they are too small of a population to derail herd immunity. Is there any validity to that?
I think it's interesting. They'll, like any social movement, they'll use a talking point that is helpful in that moment. So there are other talking points that movement uses regularly that are about, we are so many that we can affect policy change. There are so many of us now. But when it's helpful to use a victim narrative, that's the narrative that they'll use. So yeah, I think there's nuance to that answer. There are a lot of them, and yeah.
Okay. Question about the tools that I mentioned at the very beginning. I had a list of tools. I will post that. I can post that on our website. It'll be after this. First of all, this is being recorded. It will be posted afterwards. And we'll also be posting a list of some of the resources that we're referring to. One of them is from the RAND Truth Decay Fighting Disinformation Tracker. To the person who asked, where did I get the list of various tools? CrowdTangle, which is owned by Facebook. There's also BotSlayer, Facebook Political Ad Collector, Hamilton 2.0, Hoaxy, Iffy Quotient, Information Operations Archive, Twitter Trails, and Who Targets Me. But again, that'll be on the resource pages for those of you who want to know more about that. And Joe mentioned that the difference among these is that his tool is curated, and some of these others are not. Okay, we'll be happy to also take some, if you guys want to raise your Zoom hand, I see there's one up. We'll take some audio questions. Okay, we have a question from Josh Epstein of NYU.
Hi, how are you? Hi, Joe. Great work. Glad to meet you. On this question of could the anti-vaxxers undermine herd immunity, I'm an epidemiology professor at NYU, and we study these sorts of things. And to a first cut, you need to vaccinate, assuming a perfect vaccine, and on a lot of other heroic assumptions about mixing and contact patterns and all sorts of other stuff. But the back of the envelope formula for this is you have to vaccinate at least 1 minus 1 over R naught of the population. So if the R naught is 2, then you have to vaccinate 1 minus 1 over 2 of the population. That's 1/2 of the population. So if half the population refuses, you're at a tipping point. It could definitely undermine herd immunity if less than 50% adopt the vaccine. And, during H1N1 swine flu, we had about 50% refusal in the US. And, I think it could definitely undermine herd immunity, at least through vaccine. So it's a very serious problem for the point of view of COVID containment.
I think you put that very well. Yeah, another way another metaphor we could use is hesitancy is radiating outward from this group.
Yeah.
And it's eroding a lot of other things, trust in institutions, trust in science. And there are real ramifications. Anti-vaxxers are a huge proportion of all the protesters who show up at state capitals.
Interesting.
So
it's really a separate, it's a separate contagion in its own right. I mean, the way we're modeling it is there's contagion of disease, there's also contagion of fear of the disease, but there's also contagion of fear of vaccine. And if the fear of vaccine exceeds the fear of the disease, people don't take the vaccine and the thing comes back. So, and this is observed historically. It's not an uncommon pattern in the history of epidemics. And unfortunately, I think it's a very plausible one for COVID-19.
Yeah.
Okay, thank you so much. I'm going to go to a question going out of order, but we have a number of questions about the pushback on anti-vaccine reporting. A question from Hannah Wiley. Hannah at Sacramento Bee, I think. So a lot of the pushback on anti-vaccine reporting comes from people who say these are quote unquote fringe groups. But given their funding mechanisms, their social media strategies, the organized conferences that you just showed us, the presence of, very big celebrities and major, influencers who are, by the way, as you pointed out in our last webinar, often making money from their YouTube videos and have a really good revenue stream from this. So really an effective business model. So given all these factors, is it still fair to consider and call this movement fringe?
I think you could, yeah, I guess the politician's answer depends on the definition of fringe. But you have 88% roughly of Americans who believe vaccines are safe and effective. Although that's eroding every minute of every day, I would argue. So if you only have 10% of people who do question whether vaccines are safe and effective, could you make an argument that that's a fringe? I would say even just taking those two numbers, 10% of a population is not so much a fringe. That's a significant number of people with significant influence. So I wouldn't say it's appropriate to call it a fringe anymore personally. I see why people do, but I think maybe that's not a very holistic understanding of the mechanisms of the movement and who's actually in charge and how they're organized. It certainly doesn't appear like a fringe movement if you're looking at how they're using social media, how they're organizing themselves, where money's coming from. It looks like the Tea Party movement used to look like, or a similar movement. It's only fringe if you're looking at a little piece of it, maybe the group in Sacramento. But if you're looking at the whole global or the whole U.S., it appears much more coordinated than that and less fringy.
Joe, we have a couple of different questions on the quality of the medicines manufactured. I want to go back to the polling data that we had where the Associated Press poll dug into, why wouldn't you get a coronavirus vaccine? And so concerned about side effects was 70% of the reason. I'd be concerned about getting infected with the coronavirus, 42%. I'm not concerned about getting seriously ill from the coronavirus is 31% of those who said they wouldn't get it. I don't think vaccines work very well in general, or the coronavirus, outbreak is not as serious as some people say it is. And then there's my favorite, I don't like needles, 10%, just no.
Fair enough.
But there's also an issue that is being raised about the uncertain quality of medicines that are manufactured in India, the safety of the precursor components, whether the quality controls are there, and that combined with the appearance of a rush to get a vaccine approved raises fears that an unsafe vaccine is going to be rushed into production, separating the issue of whether that would be mandatory or not. Can you address that hesitancy, because there's just a fear that the vaccine will not be thoroughly tested enough and that before it is pushed out to the public?
Well, I should start by saying my branch of science is not performed in a lab with beakers and vaccines being created. So I should start there. I don't want to portray myself as something that I'm not, but I am a public health expert, and what I would tell you is, coming from public health, is that there has never been in the history of the world more scientists, companies, and governments working on vaccines. And I believe Dr. Fauci and others when they say on camera, when they're being interviewed, that we're not taking half measures on safety protocols. It's that we got everything funded up front. and we have so many vaccines all under development at the same time, that's what accounts for the speed, not a flagrant disregard for safety. So that's what I believe. I have some familiarity with the process, so it's easier for me to understand that. I actually completely understand why people are worried, because you hear speed and you think speed does not normally mean just as safe. So that's understandable. But I think I personally would say that is not a top concern of mine. Actually, a top concern of mine is making sure that we continue to move fast.
Okay. Okay, we have a question from Brett Dickerson in Oklahoma City. Earlier, Joe, when you showed the tool and you said that you had New York City and New York State, but you're going to be adding more localities. The question is, how granular will your local information be once you get that up on this tool?
The safest granularity in terms of being able to make actionable decisions is at the state level. So you can in some cases get lower. Kind of a general rule of thumb, if you're pulling in a media data from a lot of different sources, and by the way, this is all public media data, is if you have a population of 100,000 people or more, they can generate enough information that you could take a public health insight from that. That's kind of a rule of thumb. It's not always true. So, but if you think of it that way, some rural areas to get to 100,000 people, it's a really big area. Whereas if it's New York City, that's like one city block. So it depends on what's in that outline of the space that we're collecting data from. But generally speaking, if our plan is a state dashboard, and then probably not to go too much below that.
Okay, so Oklahoma State, but not Oklahoma City.
Yeah.
Okay, great. Okay, then back to, we understand you're not a bench scientist, you're a public health expert. So we're going to come back to some of the questions we're getting on how public health officials are responding. Could you give some more detail on your comment about how public health officials respond from an evidence basis? I've already told you the evidence, that's enough, go away. And they don't reframe their messages to address the misinformation. You indicated that that's changing. And at the beginning of the call, for those who are joining late, I said, why are you guys losing? Could you talk about the reframing of messages to address the misinformation and also just, address the fear?
It certainly, we are, as a sector, public health, we are behind. We're very much behind the 8 ball, but that's not out of a lack of interest or concern. I think it's out of, you need a different skill set and training to deal with some of these challenges. There's not a lot of people in public health who know how to do a social network analysis, or who are familiar with media monitoring, or who have a background in marketing or media. Their background is their background. And in some cases, it's really hard to get people in public health to talk to each other. They come with an entirely different lexicon. An epidemiologist talking to a health promotion person, sometimes that can be frustrating. So part of it is just the scale of the problem and why it is a problem. It's a lot of it is outside of the domain of the comfort level of people in public health. But if you've decided as a society that that the only people who get to talk about vaccines being safe and effective is public health, well, then that sets you up for an enormous problem. And so I think that's the major challenge right now is public health needing to quickly level up in terms of understanding more about the tactics and strategies and technologies used by this group that has decided that they're not going to listen to you no matter what you say. But also getting better, and this is an ongoing challenge in public health, at just communicating. People with a professional degree in health communications often know a lot about behavior change theory and not so much about communications. And I say that's my field. It's a field that I love, but I think that's a fair criticism. So I think we really need more cross-sector collaboration, and that's something that's said all the time, but I think that's very much true. Vaccines are a societal issue, and it will take society addressing vaccine opposition. And it is no longer a place where just public health people can be relied upon or expected to respond to it. They need to be in front and forward and, and the lead, but there need to be other leaders there too. It needs to be media and technology and a lot of other groups. And some of where you see sort of, I would argue maybe the more dynamic or innovative approaches to vaccine promotion would be seasonal flu campaigns. There's a lot that's tried there every year by hospital systems or state health departments around seasonal flu promotion. Some of it works, some of it doesn't. And there's not a lot of translation of what works into larger systems change that needs to go on if you have this active opponent. Also constantly learning and iterating.
Okay. So speaking of the societal response, question here from Susan Berger. How does the public health strategy adapt to dealing with how organized and determined the anti-vax movement is, particularly with an administration that does not appear to value science?
There are some very serious structural hurdles to public health adapting to this challenge, and part of it's legal. A federal public health agency cannot legally partner with another organization, like a for-profit, for example. So there are structural things that are keeping us from adapting quickly and being nimble. A university, for example, is much better equipped I want to make a partnership with Facebook, or I want to work with a CVS. We need cross-sector collaboration. The CDC can't do that because it's showing preferential treatment to whoever it partners with, and it's leaving out everyone that they didn't partner with. So we need to figure this out, and that's part of the reason I was saying public health needs to be at the table, but we can't rely on public health because there are some things they actually just can't do. So yeah, it's an enormous challenge, and I think the only way we get by it is more partners that are not tethered in the same way, have a lot more freedom in different ways than public health does.
Okay. So speaking of partnerships, we have a question, Paul Dinsdale. Are there any strong links between U.S. anti-vax movement and the UK group? I see former Dr. Andrew Wakefield's picture was on one slide from the United States.
I think this also could come back to potential stories for reporters. It's a global movement. And just like viruses don't respect borders, the virus of misinformation does not respect borders. And it is a articulated strategy of vaccine opposition groups to fight globally. So they go where battles can be won, and they understand that social media is a global network, and so it helps them if thousands of Australians jump on and attack a pediatrician's page in the United States. That's great. That's another limitation of our perspective in public health is unless you're in global health, you almost never interact ever with anyone who's outside of the US border. So they have a global perspective, but we don't. And yeah, there are very strong links between opposition movements around the globe. They're really the only limitation that they face is a language barrier. So where you see groups most closely aligned is where they share the same language. There are vaccine opposition groups in every country, some more effective than others. And there was the question earlier, do you see foreign government interference? There are researchers who have covered that well, and yes, we do. I don't think it's out of a motivation other than to sow discord. So they're just looking for, well, this is an opposition group that seems to cause a lot of problems. Let's help it. Let's help fuel it. So obviously, especially during election cycles. And that's not information I'm sharing with you that's new. There's really good research that's done on that already.
So we'll continue to take your questions. Joe has agreed to stay a bit longer to answer them, so please feel free to put more questions in the chat or raise your hand. Joe, I want to go back to something that you said at the very beginning that we didn't cover, which is that there are fewer than 200 leaders verified leaders of the anti-vax movement in the United States, and yet they have an incredibly disproportionate influence. Could you talk about how you arrived at this statistic of 200 leaders? And in fact, can you, if you can you show us the data on that? Because I thought it was rather striking what a small group it in fact was, according to your tool unveiled.
Well, we have a paper. So we pretty regularly go through the peer review process. So there's a paper that's about to be published on that topic specifically. But actually, it's not difficult to do that math. How we do it, it's actually extraordinarily simple. It's more about having the tool. So if you have a tool that lets you do a social network analysis, perform a social network analysis, whatever that tool is, and you just spend the time tracking information back to where it came from, you pretty quickly arrive at a number similar to that number. There's fluctuations, but if you're looking for accounts that are most connected to other accounts, that most other accounts follow. So I don't think we did anything particularly special there. It was more just, again, I think what might be new there is we're trying to pull back the curtain and just share what we're finding. And part of why we did that was it is an enormous movement, and it can feel impossible to wrap your head around it or do anything about it or address it. But if you really look at where talking points come from, it's a finite and readily identifiable group of individuals and accounts. That's not going to help you. That's the start of a strategy to address it. But it's, if you shut down the accounts of those 200 individuals, that's not stopping vaccine opposition. The reason we're sharing that information is there are 50 health commissioners. There are 50 state health commissioners in the United States. So you don't always need thousands of individuals to make something important. You just need people working together who have influence. I wouldn't. My point was not, this is easier than it appears to tackle the problem. My point was if you're trying to figure out where stuff is coming from, it's not as hard as maybe you would think.
Another specific question to the tool, Joe. Minority groups are hit especially hard by COVID-19. Can your tool be used to better understand which ethnic and/or geographical communities are most active in the anti-vax movement?
Oh, yeah, you
so
could.
Would you mind showing us how you could do that?
I couldn't do it on this webinar because that's kind of a lot of back-end math and time. And it's not set up to show that at the moment. But the real quick answer, and this won't come as a surprise to anybody on the call who uses this data, your limitation with this data is how good the data is and how much metadata is attached to the data. And you have to do some, like I said, triangulation earlier. There's an art to this as well as a science. And so in order to arrive at the answer, what is circulating most often, for example, like in African-American populations in a particular state, you would need some market research in addition to public health research. You would need to know, where do particular types of people over-index and where they get their information? And you would have to start connecting dots that aren't going to be right there for you in the machine learning. That's where your human researcher would have to do some assist. So you can answer those questions, and we have before for other topics, but it's not as simple as it just sucked in the data and it told you. It's more complicated than that.
Okay. Question from Benjamin Edelman, Business Insider. I've heard a clinical researcher describe those with vaccine hesitancy as having the right idea with the wrong data. This researcher mentioned that while medicine weighs pros against cons for a sick population, vaccines measure the same for a healthy population. So the researchers developing vaccines have the same concerns as the anti-vaxxers in the sense that the risk tolerance is extremely low, unlike, say, chemo, which has profound side effects but still worth it due to the sickness. So do you have any research as to how to get the anti-vaxxers to attend to the quote-unquote right data to assuage their concerns and see scientists as allies rather than enemies?
If the people are studying this constantly, I have not personally seen anything particularly compelling. I see a lot of small scale studies with a range of results, but it's an enormous problem that we don't yet have an answer to. Not to continue to elaborate, but the short answer is there's no shortage of studies on that topic, on your question. I don't think there's a good evidence base, like these 10 things always work, or like these large scale studies were really effective. You can point to that in other public health topics, but we're really struggling to figure out how to more effectively engage with people who are hesitant about vaccines. And there is not a lot of evidence there that points to what works. There's some. It's not that there's nothing. It's just that there's not a lot.
So in that context, Joe, could you discuss a little bit the paper by Brendan Nyan? By the way, these resources that we're discussing will be in the resource page, and you can look up this Nyan paper as well as others. This was the 2014 paper that basically said, you know what, nothing works. So they randomly assigned parents to give one of 4 interventions. They sent them lack of evidence about MMR causing autism. They sent them text information. They showed horrible pictures of children who had, healthy children who had diseases that were prevented. And then they had a terrible narrative about a baby who almost died from MMR. And they tested in a randomized control trial, they tested how these different messages played. And the conclusion was that nothing worked. So that was 2014. Is there anything that you can tell us about what's happened since the Nyan paper in 2014 about what does work?
I would actually this is just, again, my personal opinion, but there is research out there, and I can send that along for you. So it's not that it doesn't exist, but I think a flaw in our strategy so far has been not borrowing from other fields as much as we probably should be. So there's a growing field, for example, that just focuses on misinformation, and it's not focused specifically on vaccine hesitancy, but it's focused on how do you counter misinformation. There is a lot there that we could be learning from, and I think we unnecessarily put blinders on if we only consume the new research on vaccine hesitancy, and we ignore these other areas that we have a lot to learn from.
Okay. So finally, what's the message that journalists should convey to the public about the anti-vax movement, besides the fact that science has proven vaccines do not cause autism, for example?
I think digging into the movement would be helpful. It's global, it's organized. Where is the funding? I think just more reporting on really who's behind this, and cause stacking. What is individuals who show up with an AR-15 and they're concerned about government overreach at a state capitol protest? If half of the people who are there are also parents who are concerned about vaccine safety, but those two groups are saying the same thing, to me, that's a story that I don't fully understand, but I want to. And that's happening across the whole U.S. And it feels very nascent, feels very real right now, and urgent to understand that. And I'm sure that that's going on in a lot of other countries because it's a global pandemic. And so that, I think, to me, that would be a very interesting story, is not just dissecting the movement and helping me understand it, but also this cause stacking that seems to be accelerating at a faster rate than in the past.
Okay. We've got a question from Liz Sabo of Kaiser Health News on the Zoom. Tyler, can you unmute Liz?
Yeah, I was just listening to a great podcast about correcting misinformation, or the idea that listening to Taylor Swift causes Alzheimer's. But they were saying that when you want to refute that message, you have to do it in a way that doesn't repeat the initial falsehood. Because even if you say listening to Taylor Swift does not cause Alzheimer's, you're sort of repeating it and letting that stick in people's minds. Do you have any suggestions, if people bring up anti-vaccine arguments that are not true, how do you correct those without reinforcing them at the same time?
I have a slightly unpopular opinion on that topic. I I think the core of it is true. That's a accurate strategy, and it reflects what you see in the research. But I think what's missing there perhaps is an acknowledgement that there is a point where something has been seen and heard so many times that you can, and I would argue, safely talk about it. You're not making it worse. What you're actually doing is helping people understand what they've already seen. And that's something I don't think public health really gets right now, because I hear that refrain a lot is, I can't even mention that vaccines don't cause autism because that's making the problem worse. And my reaction when I hear that, and I still hear that regularly, is I think this is something everyone has heard. I think it's okay to just say vaccines don't cause autism. Like that's not a new idea or a new myth. And it's like the Plandemic documentary. That was seen by many, many millions of people really quickly, talking about why what it purported was true was not true is a public service and important for people to understand. And so I think a better understanding and more research on when is something tipped to a point where we actually need to talk about it and inform people, and when is something too risky to fan. And I don't think we really get that. And we certainly don't really get that in public health. I think there's a lot of extreme concern in just talking about any myth at all, ever. And I don't really agree with that premise.